call on George Adam to be followed by Jim Hume.
Thank you, Presiding Officer. I'm no longer a member of the Health and Sport Committee, but I retain an interest in this as an ongoing issue because many of us, from a professional perspective and from a private perspective, as Duncan McNeill has already mentioned, will know these 1 in 4 people in Scotland who will experience a mental health problem this year. And that's 1 in 4 people. So it's mathematically impossible for us not to interact with some of these individuals as well. And that's why it's so important that when you look at the Mental Health Scotland Act, we have to ensure that people with mental health disorder are able to access effective treatment quickly and easily. And as politicians, we often talk about the stigma, and it's been mentioned a few times here today already, with regards to mental health. And we often talk about how we need to find a way to ensure that our communities are aware that there's this stigma, and we talk about it, and we ensure that we have a situation where, as my colleague Bob Doris already said, where physical health and mental health are the same. We are either physically fit or mentally fit, you know, and we have to ensure that we look at it that way, because otherwise we have a situation where we still continue with this stigma. And we have to wonder, what is it like dealing with mental health issues here in Scotland in 2015? Because one of the most important things in my mind, would be the support mechanisms that's available to people with mental health issues. That's got to be very important. So today I spoke to Stephen McClellan, the CEO of Recovering Across Mental Health, Ramage. They're based in Paisley, and he said to me today that many of his clients have difficulty with isolation and loneliness. They lose touch with their family and friends and their support mechanism there. And they, as an organisation, have to come in and try and make sure they replace that and give these people that support. Stephen calls it social poverty. Effectively, socially, they end up at home, they're sitting in the house, and his exact words were quite brutal, but I think probably explains it. He says, Presiding Officer, that, you know, how can you get someone better mentally, to be mentally healthy, if their only contact with the outside world is the Jeremy Kyle show in television? Because they've isolated themselves effectively from the world. And I think that's quite powerful. It's quite brutal in what he's saying. But if we look at it from that point of view, we have to make sure that we do get out to these people to ensure that they have that interaction, because it's a basic humanity, it's basic need that people need to make that difference in order for them to be able to get better. And Ramage and Paisley have offered this type of service for 25 years. You know, their guidelines is to make sure that people with mental ill health are able to build independent, fulfilled lives. And they say that the earlier they can get to the right services to the people who need them, the more likely they are to recover quickly. And we need to be able to, they say they need to be able to respond to the demand and grow and develop their services. And much of this is reflected in the bill and in today's debate in particular. But Ramage have actually talked about 6 ways that they can do this, and by providing immediate support in crisis situations, by supporting people in their homes and individualised care, and providing drop-in centres within their community, and providing counselling to young people within their schools, effectively getting over the stigma idea as well, and by supporting carers, families and friends through education and raising awareness and misconceptions about mental health. And I think these are all extremely important when we're dealing with this issue, because, as I've said, the overarching aims of this bill is to ensure that people with mental health disorders are able to access effective treatment quickly and easily. And it's welcomed that the bill will provide an improved legislative system to help treat and care for people with mental health disorders. But this has to remove unnecessary procedures and make existing processes more effective and efficient for health professionals and, more importantly, for the patients themselves. I take on board what many of the committee members have already said with regard to the Central Register, but I think the Central Register of advanced statements will improve the control individuals have over how they wish to be treated or not treated should they become unwell and unable to make decisions for themselves. And I think that was an issue that was particularly brought up by my colleague Bob Doris as well. But the advanced statements are documents where mentally ill patients record how they want to be treated in the event of them losing the capacity to make their own decisions. And I think that's something we have to ensure that we remember, because we're talking about the individual, we're talking about the person themselves, that what we can do to make them effectively be able to be part of society again as well. And one of the other things that the Minister mentioned earlier on was the £15 million that will be invested in mental health services over the next 3 years. That's welcomed. As has been mentioned by other members in the chamber, it has to be made sure it gets to the right people in the right places at the right time in order to ensure that we can get to the individuals who really need it at that stage, because the Public Health Minister, Michael Matheson, at the time when he announced the new funding, he said that this was to make sure that we could get there quickly to offer the support when needed. And that's one of the things that I've probably gone on at length, Presiding Officer, but I'd just like to close with saying that health is a state of complete physical, mental and social well-being, and not merely the absence of disease and infirmity. That's what the World Health Organisation says, and I think we need to keep that in mind when we're discussing this issue, and remember the individual who is the one that is dealing with it on a day-to-day basis.
Thanks.